So this framework articulates those stages in a way that are non-linear, that people can be in any one or multiple of those stages at any point in time.
So it's all about what would help you live well in these kind of stages and the specific activities that would help that happen.
Just to kind of present it, like to be told to go to the ER and then suddenly you're on a ward by yourself and there's all of these people in their 60s and 70s around you, it's just a really scary thing. So I just feel like even just from an emotional support perspective, I have made some comments on there around some support from the nurse in terms of accessing like fertility information. Those are things that you have to advocate for yourself. I've since found out that there's a whole network of young cancer survivor or patient programs, Facebook groups that I had to find myself. So it would be around connecting with the nurse around that.
Right.
One, I basically replicated the example in here, clear information about side effects of chemo, but I added the word honest. I was told I'd feel sick for about 3 days and then I'd be fine. So I actually felt like I'd kind of failed when it came to taking chemo. Like I felt like I should have been having a better experience of it.
Wow. Yeah.
When you first go into diagnosis, there's just so much information, things that you don't know, and you don't know what you don't know. And it really needs to go from the doctor's office to speak to somebody who can give you an overview of everything. So decide private or public health care. How does funding work? What does it mean? There's just so much, and what support organisations are available.
I think the time with the nurse that's allocated to the area and ensuring that seeing them at your routine appointment is kind of a mandatory process, because the more you, like for patients like me that go in every 28 days, the more frequently you're seeing that nurse or a nurse, it builds your storyboard automatically over 7 years. So then that's built. It also means it's easier for them to refer you to something, be aware of what's going on in the community, because that's what we want to be pointed to. Or, hey, there's this initiative coming up, that initiative coming up, you should tie in with that.
Specific suggestions. So there are lots of free exercise programs in the community, but I don't find that anyone seems to know about it. So I would hope that a McGrath nurse would connect people with, if someone went in with what Michael's saying, they would say, oh, look, actually your YMCA offers this, please go along to that. I think that service linkage and knowing what services you can access, even in mainstream services.
What I found, there was a paucity of information with every single medical profession that I talked to, is what I should change nutritionally. You cannot tell me that I should just stick to eating junk food or, have a well-balanced diet. Or what does that mean? What are certain foods that I can eat? So if the nurses had some of that information built in, that could be given. But certainly nutrition, exercise, there's a lot of stuff, and that should be given like right off the bat, or at least there should be connections to people that can give you that. And I just find that that's missing right across the board, the nutrition side of things.
That highlights right information, not information, because what you're getting is information. It could be right or wrong. My oncologist will tell me. You tell me where we're going, what we're doing. That's me per 7 years, going through it every 28 days. There's enough on my plate. I don't need more.
No.
And if something goes wrong, it's their job to.
The information.
That's my approach.
For me, I use it as a piece of like an advocacy tool. So I took it to the nurse and I said, hey, my images are here. Can you go and check the report for me so I don't have to sit here for another 3 hours while things the process unfolds. So I think having the information is helpful and powerful in some instances, but not going so far as to then give you a differential diagnosis.
And really, unless you ask, they kind of don't tell you what it is. And it's just a curiosity thing in your head. How big was it? Or they say small. But your feeling and want for information, that doesn't cover it. Because information is powerful. It makes us feel better. We don't stress so much. The nurse could explain the whole thing to us and say, right, well, this is the scans, this is what's been seen, because when you go for your consult, whether it's private or public, they sort of gloss over things, and sometimes you kind of think you're imposing on them to ask. You think you're being a nuisance.
Yeah. I had, I guess, the opposite experience where I haven't wanted to know anything. So I think that's where, tying it all back in, I think that's where the nurse is really valuable to work with them around advocating for yourself around how you want your experience to be. Because we know ourselves, right? So I know for myself that if I had been given all the stats from the outset, that's not going to be good for my mental health, which is not going to be good for my physical health.
Yeah.
So I think it's a dangerous territory to want to push for us to have all the information. I feel like everyone's experience is unique, and I appreciate that your perspective is different to mine in how I wanted my treatment to run. But I guess coming back into the post-treatment recovery, I feel like that's where, and kind of linking in with what everyone has just said, it's around having that consistent person. And certainly I don't know much about how the model has run for the breast cancer side of things, but certainly my hope would be that you just have that person that you can turn to in those times of need.
I was given nothing.
Yeah, right.
Absolutely nothing.
Yeah.
It's like everything just suddenly drops away. The intensive support you're kind of getting across treatment, it just suddenly just dries up. And I think a supportive care nurse who's still involved in your care, once you hit the finish line, it's not actually the finish line, but it would be so valuable because they can be pointing you towards the allied health services or what you need. They can be directing you to things that are going to help with your wellness, and then also helping you manage the kind of fear around surveillance and that thing of having to constantly go back for more tests and more checks and this, that and the other.
For me, that care now I get from my GPs. After treatment, it sort of segues back to the primary healthcare system.
Yeah.
So I guess the resources are there to do some of that.
Like when is the
Absolutely.
supportive care nurse hand?
Yeah.
Yes,
back over
over
to
the
the
GP,
And-
or maybe there's I don't know if there's a model that can connect the GPs better, because I find that once you go into chronic care, unless if you're actively advocating stuff to go back to your GP and checking, looking at how to strengthen that connection a little bit better with the primary healthcare givers.
Absolutely.
That may, in my mind at least for me on a personal level, that's the role my GP's now playing.